Matthew Walker is a federally qualified health center or community health center. The communities that we serve through our organization are individuals that are working hard to provide for their families, moms of small children, caretakers of parents, people who work every day, the working uninsured, who need access to quality health care.
Siloam's mission is to share the love of Christ by serving those in need through healthcare. We do medical care, community health, and student education. We primarily serve the underserved, and we really focus on immigrant and refugee population.
So this past year has impacted our work by calling us, I think, to a higher level of service in our community. We went from responding to the tornado in Nashville, running headstrong into pandemic response and making sure that our staff were safe, that we had policies in place, that we had PPE, that we continued to provide services. And so we restructured our organization so that people felt safe coming in. Telehealth was not something that our patients could just readily jump into because of a lack of wireless or Wi-Fi services or a smartphone. Our main purpose is to make sure that people have access to health care, that they have access to early diagnosis, that they have access to medication to help manage their chronic diseases. And this pandemic highlighted the fact that there are so many that don't. There are not a lot of programs that support individuals without insurance. There are a lot of non-English speaking people here seeking help, that need help, that live in these conditions that perpetuate the virus, right? And so large families and small houses. And so all of those things that we already knew became, I think, much more known during this pandemic.
One of the things that emerged early on in the pandemic was the fact that it actually was marginalized immigrants who were being disproportionately affected. They are typically not a laptop workforce, meaning they didn't have the luxury to work from home. They work in jobs that put them on the front line around other people. Our patients aren't typically in homes that allow them isolation or ways to spread out amongst different floors. And so when a family member would get sick, it would spread rampantly throughout the entire family. So we had this population that was disproportionately affected by the disease, and then they were vulnerable in other ways. They were linguistically isolated, culturally weren't sure how to navigate the healthcare system. In the fall of 2019, we were actually raising money to open an additional clinic in the Antioch area. And then it turns out that was even more appropriate when COVID-19 struck. So we actually opened our Antioch clinic on June 23rd, right during the heart of when COVID was in Antioch and affecting that population. Siloam's tagline is healthcare transformed by love. And that's what we're known for, both in the community and in our patient population. And for us, love has looked like hugging and caring in a physical way and sitting and holding hands and praying with our patients. And so this distance in this amplified time of need and desperation amongst our patient population, I think it has worn on our providers and clinic team and been exhausting for them, really. But there's resilience. It's hard to find more resilience than that which exists in an immigrant and a refugee population. They are a resilient people, and we are often inspired by that resilience.
I'm hopeful that the work that we've done in the community will continue to move forward to address issues that we already know exist. And I'm proud of my team, my staff, my organization for being that team that people knew that they could count on, that we would not close our doors, that we would not stop our services or draw them back in any way, but that we would be there just like they knew us before the pandemic.